This is Dayton 24/7 Now.
Continuing our up-to-the-minute coverage of the coronavirus crisis. Thanks for joining us tonight. I'm Adam Merrill. The United States officially leads the world in confirmed coronavirus cases. Dr. Amy Acton, the director of Ohio Department of Health, says at the virus's peak, Ohio could see 6,000 to 8,000 new cases a day. And the state of Ohio also announcing that cases could peak past 40,000 cases this week. Now, here's a look at the latest numbers out of Ohio. The state has confirmed 867 confirmed coronavirus cases. 223 of those with the virus have been hospitalized. 15 passed away, and the youngest person with the virus is less than a year old. Governor DeWine and Dr. Atkins saying today they are concerned about the possibility of overrunning Ohio's hospitals during the peak of the pandemic. State officials are working with hospitals across the state to build up capacity. They're also working with healthcare providers on coordinating a uniform response for how COVID-19 cases are handled. New models showing the peak may not happen until May 1st. Dr. Acton says that through social distancing, Ohio is minimizing cases and saving lives. She went on to say we could see as many as 6,000 to 8,000 new cases daily during the surge. Dayton 24/7 Now's Danielle Malagarie has what's projected to happen and why two local health experts say we shouldn't be alarmed but aware.
Ohio Department of Health Director Dr. Amy Acton telling all Ohioans a surge in COVID-19 cases is coming, estimating we could see 6,000 to 8,000 new diagnoses daily.
That will be at the peak surge that we could be seeing that many cases.
The current model shows this happening at the end of April, but if we continue social distancing, it could happen the start of May. Dr. Glenn Solomon, chair of internal medicine and neurology at Wright State University, says it's important to remember.
People don't need to be fearful. They just need to be cautious.
Health experts say Ohio is about 2 weeks behind New York when it comes to cases.
They are having to create on the fly all of their new policies and how they're dealing with these crises.
Cedarville University professor and clinical pharmacy specialist in infectious diseases Zach Jenkins says Ohio has a little time that's being used to learn how to handle hospital overflow, a huge concern when looking at those new projected numbers.
We know based on the data that we've seen in Europe and in China, the hospitalization rate is roughly about 20%. That would mean about 1,200 new hospitalizations per day.
Those health experts I spoke to say we all need to remember that the numbers Dr. Acton talked about would be a lot higher if we weren't doing everything we're doing now. That's the social distancing, washing your hands frequently, and staying home if you don't have to go to work or if you don't have to make any essential trips. They say all of this will help limit the virus's impact.